Welcome to the Wellness Connection with Dr. McMinn. Dr. McMinn is Birmingham's wellness doctor, practicing cutting-edge, world-class wellness medicine at McMinn Clinic in Homewood, Alabama. Each week, Dr. McMinn interviews experts in the field of integrative wellness medicine. The Wellness Connection brings you the information you need to optimize your health in mind, body, and spirit. And now, here's Dr. McMinn.
Good morning and welcome once again to the Wellness Connection with Dr. McMinn. This is Dr. James McMinn. I'm here as usual with our moderator, Misti Walraven. Good morning, Misti.
Hey, Dr. McMinn.
How you doing today?
I'm doing great, thanks.
Wonderful. Well, we're going to talk about cardiac health today, Misti.
Interesting.
That's a really big problem in our country, and we're going to talk more about that. But we're here every Saturday morning to bring you to the latest information in integrative, evidence-based medicine, and we're trying to empower you to be the best you can be in mind, body, and spirit. So before we get going, let me tell you just a little bit about myself. I have a medical practice in Homewood, Alabama called McMinn Clinic, where we practice world-class integrative medicine. I'm a residency-trained and board-certified MD physician. I'm also currently on faculty at the UAB School of Medicine. So once again, Misti, going to talk about heart disease today.
So how big of a problem is heart disease in America?
Well, Misti, that is a huge problem. I think if you look around, it's probably the number one killer of Americans. You could take all the other stuff, add them up, and probably wouldn't equal what heart disease is. In fact, the latest statistics, Misti, something along the lines of 2,600 Americans die of heart disease every single day.
Wow.
That's one American every 33 seconds.
Wow. So is it mainly a man's disease? finally a disease that likes man?
Misti, we've seen so many times in our discussions here, so many diseases seem to be sexist, don't they? They kind of pick on women especially. That's right. But heart disease is an equal opportunity disease, and it actually picks on men and women. We do tend to think of it as a man's disease. It's kind of interesting, Misti. I think that estrogen tends to be protective in a woman's heart, but then once she goes through menopause and loses that estrogen, guess what? She kind of catches up with the guys. And that's kind of interesting there too, because when you talk about bioidentical hormones, we talk about that a lot on the show. If a woman starts bioidentical hormones early, that is, right around the time of menopause, she gets a significant protective benefit as far as her cardiovascular benefits. However, if she waits until she's about, say, late 60s or 70, and she already has the heart disease, then she really gets no protection from that.
Yeah, I think that's important to realize. People ask me all the time, should they just go ahead and be proactive about treating their hormones, or wait until something happens and go ahead and be proactive. It's the best way to do things. So what are some of the signs and symptoms of heart disease?
Well, Misti, you and I both worked in the ER for many years, didn't we? And gosh, we saw many heart attacks along the way. And of course, the classic things would be chest pain, especially a left-sided chest pain going down the arm with shortness of breath, that's pressure sensation, weak, dizzy, all that kind of stuff. So that's the classic stuff. However, it's interesting, Misti, isn't it, that women, they often don't follow the rules.
Women, they don't follow the rules when it comes to chest pain and heart attacks.
Sometimes it can be very subtle, just dizziness or something like that. So
or jaw pain.
That's right, exactly. So I think that, especially with women, we have to be very diligent to take any complaints seriously and always have this in our differential.
So what other labs besides cholesterol should you have checked and monitored over time?
Well, certainly big time. We need to watch those lipids. Lipids are the overall name for cholesterols, those kind of things. But I think C-reactive protein is another good one to get. C-reactive protein is a lab that looks at inflammation. And I think if you really look at the bottom line root cause of disease, Misti, I think inflammation is the big one. Whether it be heart disease, Parkinson's, Alzheimer's, all those are related to inflammation. So then one could ask, well, doctor, how do I know if I have inflammation? Well, you can check the C-reactive protein. It's probably your best indicator.
Well, and I think some people, too, they just go to the doctor, they get their blood drawn, and then the doctor comes in and says, oh, your cholesterol is normal. Well, what does that mean?
Sure.
You have good cholesterol, you have bad cholesterol, you have triglycerides. So I think people need to empower themselves and learn more about what's actually going on with the lab test.
Yeah. In fact, there was a big study out of one of the major Harvard teaching hospitals up in Boston. They looked at C-reactive protein as a predictive indicator for heart disease as compared with all your cholesterols. And guess what? The C-reactive protein was a better indicator. So I think along with the lipids, it's important to measure things like C-reactive protein. Another one called lipoprotein A is important. That's really the killer component of the LDL. The LDL being your bad cholesterol.
The bad cholesterol,
right,
exactly.
Exactly.
Low density lipoproteins.
Right. And so we always check that. Other things like the ferritin can be very helpful. Homocysteine is another important lab that we sometimes check for people who have a high risk of heart disease. So all those kind of add up as just factors that we look at for a heart disease.
I think homocysteine has really come on the scene in the last 5-10 years, and I think it was checked routinely before that.
Yeah, it has. Although sometimes the insurance companies haven't quite caught up. I know it there for a while.
Insurance are always they're always the last ones to know.
Even somebody who had a significant risk profile, I would order it, but it often wouldn't be paid for by the insurance company. So that created a problem. But I think more and more people are realizing the value of homocysteine.
Other than lab work, is there any other tests that the doctor might do to evaluate a patient for heart disease?
Misti, one of my favorites these days is the coronary calcium score.
Oh, yeah.
It's a really wonderful test. You don't even have to have a doctor's prescription for it. There are a number of folks around town who do it. I'm not sure of everybody, but I know over at Trinity they do a nice job. I think down at Shelby they have a cardiac CT. And I know there's a group out at the old Medical Center East, which is now St. Vincent's East. The heart group out there, they have a good scanner. It's what we call a 64-slice CT scanner, Misti. It shows an amazing view of the heart and gives us something we call a calcium score. And if somebody has a calcium score of 0, that's about 99% predictive that they'll have no significant heart disease in the near future. It's not a great test for somebody with symptoms. So if somebody came in there having chest pain, it's not something you do. But on the other hand, for an asymptomatic patient, it would be a good test for a screening test.
So more preventative measure.
That's right. Certainly other tests that doctors do along the way, and these are more for people who have symptoms, would be the exercise stress test, the echocardiogram, the stress echo, all those things can be very helpful. If somebody has rhythm issues, then that could be things like a Holter monitor or an event monitor can be helpful. So those are all things we use to screen chest pain in symptomatic and asymptomatic patients.
So if someone out there is listening and they're having palpitations, they should get with their doctor and wear probably an event monitor. Or
that's right. A Holter would be a good thing. Well, you bring up a good point, Misti. We're so blessed in Birmingham. We have so many wonderful cardiologists and physicians here in Birmingham. And of course they're totally hardwired with this kind of stuff. So anytime somebody's out there having these kind of issues, definitely you get together with your primary care doctor or your cardiologist.
So what are some general recommendations for prevention of heart disease?
Well, Misti, I think that it all starts with that sort of pyramid of wellness that we talk about all the time. Sort of good nutrition and hydration. Exercise is huge. I mean, definitely. A wonderful book by Dr. Robert Greene called Perfect Balance. It talks about a significant reduction in heart disease with exercise. And, of course, getting a good night's sleep. People who have chronic sleep deprivation definitely have more heart issues. Of course, stress reduction is another one, and weight management. I mean, all the things we see on that pyramid of wellness.
Yeah, you really can't stress enough the idea of exercise. And, for some people, it can be free. It's something you can do, something as simple as getting out walking. Just getting your heart rate up for about 30 minutes, at least 3 times a week. I think people underestimate the power that medicine has, as far as depression and fatigue and high blood pressure and everything.
Well, I tell patients all the time, Misti, there's no more powerful medicine on earth than exercise.
Exactly.
Yeah. And otherwise, managing your lipids, working with your doctor to get those down, controlling hypertension, smoking cessation. Of course, if you're a smoker, oh my gosh, gotta definitely cut that out, right? And we talk about that all day long. And we talked about reducing inflammation, and we'll talk more about that, but certainly that's one of the keys. And we mentioned getting a good night's sleep. Blood sugar is huge. There's so much insulin resistance these days, Misti.
Metabolic syndrome.
Absolutely. People, unfortunately, as we get older, sometimes we don't process our sugars like we used to, and that's called insulin resistance. And from that, we often get the weight, we get the heart disease, and all those kind of things. So, managing those things, treating metabolic syndrome, and we'll talk more about that in just a bit.
Yeah, I'd never heard of metabolic syndrome in all my years of nursing.
Oh, really?
Before I started working for you.
Oh,
It's
my
never,
gosh.
not something that's brought up.
Well, sometimes I wonder if I'm just making it up.
It's a Dr. McMinn disease.
Yeah, but because I see so many people coming in with it, and it's been unrecognized. It's one of those things where you have to kind of connect the dots, but certainly it's recognized by people like the American Heart Association. I mean, they have strict criteria for metabolic syndrome. And so definitely controlling that, and we'll kind of break that down in just a moment. But controlling your thyroid function can be important. Avoiding dehydration. All those are general things that you can do to help improve your cardiac risk profile.